Hello and welcome to our session today on technologies for health and wellness. I'm Kirstin Salyer, Head of Editorial Strategy and Thought Leadership at the World Economic Forum. I'm joined today by an esteemed panel to discuss one of the key trends and opportunities in health and wellness today, the rise of digital technologies. The global market for digital health and wellness is estimated to reach up to $1 trillion in the coming years. Now that rivals the size of the global revenue for medicines. From smartphone apps to telemedicine, from wearable tech to AI and the immersive world of the metaverse, digital technologies are transforming the field, extending health and wellness beyond the four walls of a clinic and into our communities and our homes. These technologies hold immense promise to increase access and improve outcomes and quality of care. But as the lines between the physical and the virtual and between health and wellness become blurred, it raises new questions about security and equity. Our speakers today will share their thoughts on how companies, governments, and civil society can come together to navigate this transformation and ensure digital solutions deliver on their potential to improve health and well-being for all. It is my pleasure to present our panelists, Nabil Gohir, Chief of Asia, Middle East, and Europe at PATH, Bjoern von Siemens, Founder and Chief Financial Officer at Caresyntax, and Federica Alberti, Director of Wellness Foundation at Technogem. Welcome and thank you so much for joining us today. Thank you for being here.
Thank you.
I'd like to start our conversation with you, Nabil, and talk a little bit about the recent innovations we've seen in the healthcare space. We've seen this incredible opportunity for digital technology to improve outcomes in health, but at the same time, there's been this persistent inequality in terms of access and care. How can we harness digital technologies to address this divide and improve lives?
Well, thank you very much, Kirstin, first for inviting me to this very interesting conversation and very topical, I would say. I'll start with the last part of your question, which is at the heart of our mission at PATH, which is inequity, because our mission is health equity. It's global health equity, and we are very concerned about it. Let me quote a few figures before I start on digital health and other stuff. We are coming out of a pandemic, but it's unfortunate that in least developed countries, which are 44 countries of the world, only 3% have been vaccinated so far. So a person who is born in a least developed country is twice likely to die with an infectious disease as compared to other countries. And then also the health lifespan in these countries is 20 years less than the developed countries. It's unfortunate that in this time and age of technology-driven world, we have a situation where people are still dying from diseases which can be prevented. Now, there are several aspects of health inequity. There's a political dimension. We work in Ukraine, in Myanmar, in Ethiopia, and we see people dying because of the political situation, both internal and external. There are economic dimensions of health inequity, and that relates to, for example, the food prices, fertilizer prices, rising inflation, which affects the health of people in that country. There are social dimensions. If you come to a lower social strata in the society, you're more likely to have bad health. And of course, for us, the most important thing is technology as the determinant of health. And within technology, in PATH, which stands for Program for Appropriate Technologies in Health, we use science, technology, innovation, and digitization as the lever, as a point of entry for us to work on health systems in both LDCs as well as helping low and middle income countries. Science, a lot of our work is in vaccines research and development. We developed the first malaria vaccine. We developed the first meningitis vaccine. Right now, there are 40 or so projects in the vaccine space. because for infectious diseases, we believe that this is the most needed. Technology is science in action, so a lot of digital devices, diagnostics, and platforms, we are very active in that space. Innovation, we look at innovation from a very different perspective, which is inclusive innovation. And inclusive innovation is not only the cutting edge technology, but also what is there in least developed countries, in LMICs, and how can we help them develop ecosystems at their own place, rather than saying that we know it all and you don't know anything and we are coming to develop you. So it's more of looking at India. They have their own model of innovation, which is frugal innovation, which is called Jugaad in their own language. So we work very closely with them, and in Africa. Last one from my side on digital health. Digital is a way to leapfrog, this particular area. Health systems, we are working on developing platforms. We are doing mapping for developing countries to help them understand where the gaps in their system. We are helping them use data more intelligently, decision-making dashboards and stuff. Well, it's a long journey, but we're getting there. I'll stop here.
I like this analogy of it being a journey, and some of the expressions of the idea of science in action, digital as a lever to kind of affect change. That actually speaks really true to your work, Bjoern. I'd love if you could tell us a little bit more of how you see the advancements in emerging technology affecting your field, and specifically the use of data-driven technologies to affect change. What has been your experience?
Yeah, there's a really, tremendous potential in the use of digital technologies across healthcare and in our field, which is surgery. And I can start with a story that actually yesterday we had a discussion with a surgeon, and she's really doing fantastic work. She set up the first surgical operating theaters in refugee camps. So basically bringing really something that is usually a luxury good that we have here in the Western world to the frontier. And the way to do this and to scale this is really with technologies that we have, because you can bring knowledge, you can bring tools, digital tools via basically internet and phone or Wi-Fi connectivity into the operating room in a very remote place, and enable people to do life-saving things that was previously not accessible. So if you're talking about access to healthcare and healthcare services and access to surgery, which at the moment 5 billion people don't have access to surgery in this world, then technology can make a huge difference. And on the other side, if you look at what we're working on in our core markets, which are the United States and Europe, there's also, even for us who have access to these very sophisticated procedures, very high risk associated with basically going into an operating room. There's variability, there is basically uncertainty, and the way to counter that is with a much better data systems. So interoperability between the system that is used to treat and monitor the patient during the procedure with systems where your patient data is from before the procedure, so that the team and the caregiver can really personalize the approach and understand what are the risk factors that you as a patient have vis-a-vis others, and really tailor the procedure. So I think it's definitely a very, very big impact on access that we can have as technology, even in something as difficult and basically complicated as surgery. It makes it scalable, it makes it transportable in a way from a perspective of high quality healthcare services. And for us, it means it's much safer and more personalized if we use the data that we actually have or if we put the data that we actually have in the hands of the caregiver, of the surgeon and the team.
Absolutely. And one of the key themes seems to be around access. unprecedented access, whether it's in a remote refugee camp or just targeting new segments of a population in a country that already maybe has the existing underlying care. That actually brings us really nicely to your work, Federica, with wellness. And I'm curious to hear your thoughts, particularly over the past few years, how digital technologies have affected how we think about wellness and how we access wellness, and what the potentials might be for partnerships to further bring this to more people.
Okay, thank you very much for your question, Kirstin. Well, the digital technologies have impacted a lot our wellness sector, and I see a big potential also for the future. Let me maybe focus on one of the components of wellness, which is physical activity. And now we all have smart equipment, mobile apps, smart watches, and other wearable technologies that are actually helping us in either having personalized, customized, tailor-made experiences. You can train anywhere, everywhere, thanks to technologies. But also, and most importantly, they can allow to collect data, which are very precious, because you can combine those data with other sources of data, like, for example, health data or, I don't know, sleep patterns and so on, and share this information with doctors or other healthcare providers to help them to make data-driven, informed decisions, which is very important for our health. And technology actually was a pioneer in this, because they started to launch the first software in 1996, and then the first internet-connected equipment in 2006. But now they can offer a fully connected ecosystem, connecting different operators. And this is key, and it was the reason why it was selected as a partner for researching as well. We are partnering with major institutions, health institutions, research centers, universities, to prove the impact of, for example, physical activity and physical exercise as a very useful tool for prevention on one side, but on the other side also, and this is the most promising one, as a medicine. As a medicine for different pathologies, serious pathologies, including some form of cancer, for example. And digital technologies are very helpful because on one hand, they allow to highly engage the patients. And this is very important for their motivation as well. But on the other hand, we offer some digital services given to doctors and healthcare providers, very important tracking measures, the impact on the quality of life of the patients, and you can really tailor the programs to the need of the patient. So now we can speak about precision exercise medicine, which is really a new frontier and very promising for the future. And I mentioned this partnership because we are fully aware that in order to, let's say, shape the future of health, we need the cooperation of multi-stakeholders, because operators like us can provide data or equipment, but healthcare can provide also information on that. The governments can define policies which goes in the right direction, define privacy issues and so on. So it's really a multi-stakeholder cooperation that is shaping the future of health, thanks to the digital technologies.
I think that brings up an interesting point around this partnership aspect of it. And you brought up this idea of how things have changed even just in the recent years with the COVID-19 pandemic. We saw in a lot of ways a lot more personalized access coming directly into people's homes in a way that hadn't really experienced before. There's a lot of aspects to unpacking what these last few years have meant. I'm curious if you could share perhaps briefly your thoughts on what the pandemic has meant and how we leverage the best of what the digital technologies have come to continue that momentum in the coming years. Maybe I'll start with you.
Well, happy to start. Well, partnerships, I used to say, is part of our DNA in Path. And our brand is respectful partnerships. So I'll go back to the point which I made earlier, and that is partnerships should not be top-down, vertical, where there's a donor-beneficiary relationship. They should be more horizontal, which are on the basis of respect. So it's not developed country, giving money to developing countries. It's more of, okay, what can we learn from each other and how do we share experiences? Let me give you a few examples. Like in India, for example, we are doing a trilateral partnership in TB in the slums of Mumbai, where the government wants to give vouchers to the private sector. So we are training them and building their capacity and bridging that gap between the government and the private sector. So for a Canadian and Swiss company, we are working actually helping them to test a new app which will be helpful. When you scan your face, you will be able to judge the cardiocircular situation of your body. So it's a frontier technology that with 96% or so accuracy, you'll be able to predict where you are right now.
That goes to your point about that personalized access and care that has that data right in your
Absolutely. So this is our partnership with the private sector. We work very closely with governments. We have signed an agreement with Africa CDC because regulatory issues in digital technologies is a big game because technology is moving very fast, governments are slow, and there's not much which has been done in that space in the past. So we are helping least developed countries as well as LMICs to develop the regulatory environment. So it's a game in which all of us, we are together. And I keep on saying on partnerships that on our own, we remain invisible. But if we work in partnership with others, private sector, academia, government, then we become invincible.
I like that, invincible, especially talking about health and wellness. That's a positive note. Drawing on that, Bjoern, we're talking, just to bring back to your point on data, partnerships, data, there's a lot of questions about interoperability, security, making sure that any fears around risk are addressed. How do partnerships play into that aspect of your work?
Yeah, they really are the key element or the basis for access to the data and for making these technologies available. Because what is really fascinating in healthcare is if you look at, for example, our area, surgery, the technologies that are used in operating rooms are oftentimes 20, 30, 40 years old as digital tools, for example. And there's so many new technologies that we have and methods and systems that tomorrow, if you would implement them, they would really improve the situation dramatically. But there is a lot of barriers. So there's really a lot of barriers in healthcare, and they're oftentimes for good reasons, because you need to protect the patient and you need to make sure that technologies are safe to use. You need to make sure that data is protected. But that really creates massive barriers, just practical barriers, but also cultural barriers to innovation and to adopting innovation. And so I would say there is a lot of wonderful things we're doing every day and we can do every day. But the potential and the big question we are often being asked and asking ourselves is, how can we make sure that the tech that is available and used in other industries very successfully, we talk a lot about, let's say, how did we reduce the risk of commercial airlines flying? Today is a very safe space. It's very actually economically affordable for a lot of people to do that. We could definitely do the same in surgery if you deploy the same methods and technologies, but a lot of barriers to entry. So and to scale that. So that's one issue. The other issue is who's paying for it. Yeah, so basically, if you have a technology, you can show it works. How do you integrate it in the system? And that makes it very challenging, again, for developers of systems and technologies, because you have to address two stakeholders. You have to address the patient safety, improvement of care, which is the core, and that everybody understands. And then you need to adopt to the system. Yeah, you need to make it basically integrated into the payment flows. And that is very challenging to do both. And that's why the adoption of tech oftentimes It takes more time than people expect or than you would expect. And that's where I would say the pandemic in a way played a very, despite all the horrible things that happened, a more positive force, because we were able to witness the speed, how you can access information, how you can treat people, what does it mean if you have an interoperable system, the lab results are coming back in a week or 2 weeks, they're irrelevant. You need them on the day because you need to know if you are positive or negative. So these things are clicking in the heads of people, and that was for us and what we saw really positive force of change and understanding in decision makers heads to really create these partnerships and to wake up a little bit the ecosystem for the use of technology.
We're talking about a mindset shift here with regulation, with adoption and scale. Federico, you mentioned that this idea of rethinking what can be types of medicine is changing. What has been your experience in how you move that forward while also addressing potential risks or fears?
Yeah. Well, I fully agree that the pandemic helped in this sense, because it helped to lower some barriers that are still there, but I mean, it gives a really an acceleration in this sense. It helped to understand the real value of health, that is very clear to all of us now. But on the other hand, the pandemic highlighted all the weaknesses of the health systems all over the world. And the combination of these 2 points actually is pushing for a big shift, a shift from the current models that are sick care models. So we are focused on diagnosis of pathologies and cure of pathologies, to a healthcare model focused on healthy lifestyles and prevention. And this is a very complex shift to make, and all the countries are struggling to make this shift, and it requires the cooperation from different stakeholders, a very big cooperation in this sense. But it's very important for the sustainability of the future in the system. So it's a long journey, as we heard before, but it's really the way we have to proceed with. So everybody can give a contribution on that. And it's also a mindset change which is required, because we are, let's say, used to consider health as a right, and it is a right, of course, but it's also a personal responsibility, and the digital technologies can be a strong enabler in this respect.
Are there any, we've talked a little bit about barriers. Are there any barriers that you see will need to be overcome in the next 5 to 10 years to really see some of the benefits that we're talking about? Maybe we can start with you, Federica, and just briefly hear from your perspectives.
Well, I think one of the barriers is understand how to treat with the privacy issues, because in the health sector, this is a big barrier. It's also potential, but it's a big barrier. And also, I would like to consider a barrier. I mean, we need to ethically use technologies. Especially, I'm thinking about the Gen Z generation and the youngsters, because they are really using technologies, and they take care a lot of physical and mental health, and they consider technologies as an enabler, but still they spend, I don't know, 8 hours, 10 hours with technologies and in front of screens. So we need to find a balance, which is not easy to find, but I think this is one of the biggest challenges we have.
What about in your work, Bjoern?
Yeah, there's a lot of barriers, and I can maybe focus on 2 barriers that are very interesting, and that we're also doing a lot of work with the forum on overcoming. One is definitely paying for health. So at the moment, we have this sick care system which is paying per case, and basically, if you do more surgeries or more diagnostics, it's actually good for business. And this has nothing to do really with the outcome if you just look at it from a factual perspective. And so we really need to work on that, changing the payment structure and the incentive structure to make it worthwhile to not do a surgery, or to make it worthwhile to not do an diagnostics, or to basically really focus around what is best for the patient and how to predict that. And that is very, very difficult because it involves measuring things that are difficult to measure from the outcome perspective. We oftentimes don't know the cause and effect relationships. It's very complicated. So it's not something that you can switch on or off. It's more something that you have to kind of move towards step by step. It's incremental. That is definitely one element. And the other thing that came up here as well, I think, is we need to get used to pay for data quality, or pay for data. So we can say data heals, and so there's at the moment no reimbursement code really for data. There's some reimbursement codes already for digital apps, but if you're thinking about the quality of the diagnosis or the treatment is really dependent on how good the data is the doctor has. So there should really be a reward for that quality of input,
Right.
in a way, because it's so important for the health outcome. And those are two shifts that would really help accelerate adoption.
And Nabil, in your perspective, you could say a barrier in one word that we should overcome. What would it be?
Okay. Well, we swim in an ocean of barriers,
I would say.
To be honest. Global public health is fragmented, very vertical. That's one big barrier. Digital is not. It cuts across everything. At the national level, you have policy barriers, you have regulatory barriers, government's lack of understanding, because they're not structured to think in a certain manner. So there's an understanding barrier which is there, and something which Bjoern mentioned, and that is the interoperability barrier. In big countries, you have federal governments and state governments using different systems. They don't talk to each other. So data systems, digital systems and stuff. Then barriers in terms of understanding digital tools.
Right.
Because there are so many, every day you get so many apps. How do you make sense of which one works for you and which one doesn't? So should you go for that rating which you see, 5 stars, 4 stars, which is more social? Or should you look for something which is more technologically apt, whether it's safe for you or not, or somebody is trying to collect your data and use it for some other purpose? So that is another barrier. Another beautiful point which was made earlier was behavioral barrier. Telling people that your health is in your own hands, right? You don't have to go to the hospital. Hospital is a repair shop. That's not your primary call, port of call. So have good food, have good nutrition, look after yourself well, and then you'll be well.
Well, I love this sense of optimism, and I'd love to end on a note of optimism and a hope for the future of where we see this going. If I could ask you each, just in 1 or 2 lines, what is your hope for how digital technologies can transform health and wellness? Nabil.
I'm a born optimist, to be honest. I'm very hopeful that we can leapfrog using digital technologies, especially to bridge the inequity gap that we have between least developed countries, low and middle income countries, rich countries, and within rich countries, there are some segments of society. So I'm very hopeful that digital technologies, biotechnologies, and other frontier technologies have a huge potential to bridge that gap if we move forward wisely and with conscience.
Yeah.
Yeah, very similar thoughts to what I was thinking about. I think the biggest opportunity is really bringing down the cost dramatically of very good care and personalized care, make it accessible and scalable. So the health equity opportunity that we have through technology is real, and that would be my biggest hope that technology can bring.
And Federica.
And my biggest hope is empowerment. Empowering people to take care of their health proactively, and empowerment for government and civil society to take informed decisions and move forward in this direction.
Well, thank you so much to all of you for being here today. I think it was a really interesting discussion on how we can identify and come together to come up with solutions to address some of these barriers we've been speaking about today, but also to then move forward and achieve some of our hopes around equity, access, affordability, and empowerment. Thank you so much to our panelists. Thank you to everyone watching on our digital channels. See you next time.